Welcome back, everyone. And I'd like to hand you back to Stella Ekabusi to introduce the next session. Thank you, Stella.
Hi, everyone. Welcome to this next session in track 1. It's blended learning in health professional education in a developing country, how to simultaneously support both students and teachers. Don't forget to type your questions in the Q&A box at any point throughout the session, and I'll be putting those to the speaker at the end. So all that's left for me to do is to introduce our speaker, Narasimhan Swaminathan from Sri Ramachandra Institute of Higher Education and Research. Over to you, Narasimhan.
Thank you, Stella. Good day to all. Happy to be a part of this wonderful event. I'm here to share our experience, how we embark this blended learning in health professional education in our institute. From a developing country's point of view, the challenges what we faced and how we could successfully implement blended learning in health professional education. Yeah, I bring greetings from Sri Ramachandra Institute of Higher Education and Research, Chennai, India. So the objective of today's session is to discuss the blended mode as a method of teaching in health professional education, as well as to discuss the opportunities to implement blended learning in health professional education. We would also like to discuss the challenges in implementing blended learning, especially from the developing countries' point of view. So why we need blended learning? We realized the need for blended learning because three major reasons when we looked into blended learning in health professional education, especially in our institute. The current generation of learners, they are different from the previous generation. They are more looking for digital learning, and they want to actively engage themselves in learning. And the educational context is also changing. Even recently, our government is also encouraging the higher professional education to move towards digital teaching. Then the digital initiatives, which is required by the the reformation which is suggested by the ministry and the government, which made us to think to implement blended learning. Being a health professional institute and a health professional institute, it was difficult for us in the earlier stage to implement this kind of innovative teaching method. So another point why we need blended learning is now the teaching should be student-centered. Earlier, in many of the institutes, we are still focusing. It is teacher-centered. Now we should move towards student-centric teaching. In student-centric teaching, the teacher acts as a facilitator, as a delegator, and as a role model. So to facilitate learning, blended learning seems to be one of the method in health professional education, which may bring in the desired changes, and we will be able to move towards student-centric method if we start implementing blended learning. So what we have done initially, this is one of the systematic review we have taken, and then before that we did a scoping review. We looked into the published literature, especially in health professional education. So we could understand the evidence which supports the implementation or the successful implementation of blended learning elsewhere. So what we understood through this systematic review and the scoping review, there are various definitions which are provided for blended learning. So, some of the definition which says, the combination of instruction from two historically separate models of teaching and learning, But for our purpose in our institute to implement blended learning, we adopted a definition which is, proposed by Garrison and Kanuka that says, the blended learning is a thoughtful integration of classroom face-to-face learning experience with online learning experience. Here, which we focused is mostly on the seamless integration of traditional face-to-face learning with online activities to enhance the learning experience. So that's the definition we adopted in our institute. When we look into the theories, underpinned when we are implementing this blended learning, so one of the theory, which we could able to demonstrate, we could able to apply in our context, a community of inquiry. According to this theory, there are three elements: the cognitive presence, and the presence of teaching, and the presence of social. So there are different categories in that, and there are different indicators in that. So when we design a blended program, a blended course in our institute, we found this theory is very much applicable, and we could see there is a the application of this theory very much into the teaching learning process. Another thing what we understood, the hallmarks, there are four cornerstones of blended learning, which we when we implemented blended learning, we could see how these four aspects are important. First point is seamless integration of online and face-to-face sessions. There should be integration between the face-to-face and online sessions, especially when we are importing the skills, the psychomotor domain, when we are focusing, the integration becomes very, very important. And the other point is increased learner control. That is the one of the advantage that makes this method maybe a more provides more flexibility to the students, and that this makes this method a student-centric method. The learners control, they control their time and pace of learning. We also identified through some of our, the preliminary research, even the slow learners, so-called the slow learners, they are getting benefited by this method because it provides them the flexibility. Another point what we understood from the literature, also from our experiences, the presence of the facilitator in the online, during the online session, the facilitator has to be present there. We need to use the tools, the digital tools, to make our presence be as a facilitator during the asynchronous learning. The other point is what we understood, as even the literature says, the repurposing of the time, especially in health professional education. The face-to-face teaching we used more for in-depth learning. We repurpose the face-to-face teaching to provide them more opportunity to develop their higher order learning, and when it comes to psychomotor, the skills, because in the asynchronous mode, they will be able to understand the procedure, what they're going to perform, and they will be able to understand the nuances of the practical aspects. And when they come to the lab during the face-to-face session, they were able to practice better, and that provided them to develop their psychomotor skill in a better way. These four hallmarks, what we were able to implement, and we were able to see the difference. What we also identified, again, based on the literatures and our experience, the designing of the blended learning, the four important components: the development of the content, especially for the online asynchronous delivery, the content, the creating the video lectures, podcast, and keeping the textbooks and the external links readily available through the learning management system for the learners. And the other important aspect is to creating the collaborative activities. That is what we see a major difference from the traditional or routine teaching from the blended learning. The collaborative activities, it should be the learner as a facilitator, learner-facilitator collaboration, and learner collaboration. That's what we could see. These digital tools became very handy. There are various platforms available. Even within the LMS, there are various tools. We will be able to successfully use these tools for these collaborative activities. Another aspect is important. We all know that assessment drives learning. The online assessment, after the asynchronous learning, it has to be assessed. Again, these digital tools were very handy to assess, whatever the outcomes we defined. Let it be an online quiz or submitting the assignments online. There are various methods. These methods becomes handy. Another, as we discussed in the earlier slide, the face-to-face session is effectively used to repurpose the time. The face-to-face sessions we are effectively using for group discussions. And the presentations, the students are encouraged to participate in the debates and interactive lectures. These activities provided them the opportunity for active learning. At the same time, this encouraged them to understand the subject in depth. The higher order learning was possible. That is what when we designed the blended learning. We also understood the advantages of blended learning based on the literature and our experience. From the learner's perspective, it encourages the active learning. As we discussed, it provides more flexibility to the learners. They can learn on their own pace, because whatever their level of learning, even the slow learners, they are able to learn better because the materials are available for them, and they will be able to collaborate with their peers and the facilitator in the through the online learning environment. From the educator's perspective, as what we understood, it really repurposed the face-to-face time. We can really go into the in-depth of the higher order learning. When it comes to psychomotor, the development of skills is better because we can focus more on facilitating their the skills. It also reduces the face-to-face sessions for theory teaching. When we take it from the health professional education aspect. For the institutional perspective, we are able to use the physical infrastructure effectively. Probably it could be economical in higher education if it is implemented properly. Another thing came to our mind, designing the online component was a big challenge for the faculty members. At the beginning, till today we are facing some of the difficulties. We need to understand what learning outcomes, whether these activities are motivating the learners, or how I will be able to engage my learners here. How I can facilitate or motivate my learners. All these points needs to be kept in mind while designing the online component of the component of blended learning. That is what we learned in the last 3 or 4 years from our side. Another thing based on the literature is, what we need to understand, there are various factors which influence the blended learning. So one of the important aspects at the beginning is what are all the learning outcomes. We realized that defining the learning outcomes is very, very important, because based on the learning outcomes, we will be able to design the learning materials. We'll be able to design the assessment methods. So everything based on the learning outcomes that needs to be clearly defined. And then we need to also understand the learner characteristics. This is one of the challenges what we faced. we identified their what they expect, and which suits for which type of learner. That is also important. Then creating the learning environment, because here when we embarked into this blended learning, creating the online environment, we had the physical environment ready. Creating the online environment was a challenge, and we realized the online environment should be conducive and it should be user friendly. Another point what we realized is the organizational support. It's all already established in the literature. We also experienced that, and then creating the infrastructure necessary. That was a challenge, especially when we are working from the institutes from a developing country. The delivery of the content, it should reach the learner. That one of the important factor. We worked on that very much when we could see the change in the learners' behavior, as well as we could, when we analyze their feedback, when we looked into all these aspects and we implemented this, we could see the change. So based on this background literature and the experience what I shared, what we did, we established a learning management system, which was very simple one, managed by the institute IT section, and we went into the faculty training. That's what this is about. That was the one which helped us in implementing this very successfully, training the faculty members. And then we also developed the other infrastructure simultaneously. We implemented some of the programs. We will be discussing the results in the forthcoming slides. We also looked into the feedback and we analyzed the impact. Now we are establishing this blended learning to other courses. We implemented in some of the programs, and we are extending it to the other programs also. We also looking into the continuous quality assurance. So what we have done, at the beginning, as I told, we analyzed whether our students are ready for blended learning. We prepared a questionnaire, structured questionnaire, we validated it, and we analyzed whether they are ready. When we looked into that, because as I told, there are lots of challenges here, the availability of internet, availability of the electronic gadgets to the students. That was a big challenge. When we looked into that, their readiness, we found the students are ready, and they also had, some of the challenges, the barriers and challenges. As I was telling, the availability of internet and gadgets, that's not easy for the developing country, and the quality of contents, because the contents which we need to develop for the asynchronous online learning, that was a challenge from the students' perspective. And they also felt they will not be able to access the teachers during the asynchronous online. And then they also felt some of the health related issues, and they may not be able to concentrate because they were not exposed to online component of learning. So these are all the challenges what we identified from the student side. So we kept this in mind when we designed the blended courses. What we did, we ensured that all the online activities what we are preparing, even our LMS should be accessible through the smartphones, a simple Android phone, they should be able to access. That was in the agenda when we started the designing this blended learning. So the content should be easily accessible. So this we did based on the study which we undertook. So after that, we also identified the importance of the training of the faculty member. So what we did, we created 3 levels of program for the faculty member. We offered this program in blended mode by using our learning management system. We offered these programs in blended mode. At the first level, we just know how the basic level. The second course, that we call that as an intermediate course. There we took them to the level of Shozao, and then finally advanced level they were able to create the blended course, and they were able to deliver a module. So that was we trained our faculty members through throughout last 2 years. Now we are continuing this training also. So the moment they trained, they were able to implement some of the modules in blended learning. The challenges when we ask them, they are also ready to adapt. What they found, if you see this graph, they all understood the blended learning. They will be able to use the digital tools to engage the learners. They understood that, after completing this course, and they also felt that they will be able to provide feedback better, and then the discussion boards will be used to encourage the collaborative learning. These are all the perception from the faculty side. The major challenges, again, from the faculty side, faculty member side, the educator side, they also felt requirement of the infrastructure and students' readiness. They were skeptical about the students' readiness. We could demonstrate with the previous study, the students are ready. They also felt lack of time, creating the content and all those things will be a challenge. And they also felt they require that training. So that is the reason we went for this training. So we were successfully implementing the able to implement this blended learning training for our faculty members. Later, during this pandemic, we are forced to offer the courses online. At that time, we were ready with our LMS. Most of our faculty members were ready to, they were able to deliver their courses online. The problem with online, there was no face-to-face. We know that we were not able to deliver the psychomotor skills during the online training. So when we looked into that, when we asked their thing, whether the students will recommend online learning, after the when they undergone the courses during pandemic online, if you see, many of them, 41% they said they will recommend because of their previous experience. But we had, many of them, some of them said not sure, because they had lots of challenges when the courses were offered only online. The contributing factors, they are willing, they were willing to contribute. They had previous experience of online learning, and they also had, the online content. They perceived the advantages of the online content. But again, the challenges, again, they felt the same similar challenges when we asked for the readiness. So that is again mapping with it. So that's what we understood. Only online may not be effective. Even the students are not perceived. So then we started the blended implementation, the courses earlier, what we decided. So one example, this course I would like to discuss here. While designing the course itself, we thought how we will be able to provide this experiential learning. One course as an example I would like to describe here is we designed a course for evidence-based practice for our allied and health sciences, physiotherapy, and all other allied health science students. We use this model to create concrete experience. We used asynchronous online video tutorials, we supplied online reading materials. Again, for reflective observation, we used online discussion boards and reflection writing through online, through the LMS. For abstract conceptualization, we used face-to-face interactive lecture and small group discussions presentation. And then we also allowed them to further active experimentation as an online group and individual assignments, reflection and peer feedbacks were given. So this is how we designed the blended course. The face-to-face session and with asynchronous and synchronous session. So when we did this, we asked them again, this is how do you compare your online only and blended? Because these particular students had online alone courses also. When we compared this, majority of the students felt blended learning was better for understanding the subject. that was better in faculty interaction. All the aspects, they all felt blended learning is better when compared to online. So we realized, the blended learning, even the students feel blended learning is effective when compared to online alone. We also, went to the other study with some of the courses offered in the routine teaching and the blended learning. We found the similar results. When we analyzed, we also went for a group of people with a, focus group discussions. When we analyzed, they all felt, whatever is there in the literature from the developed countries, it's mapping our finding also. The students felt the blended learning provides in-depth learning. It encourages the collaborative learning. All the positive aspects, published from the developed countries. Our findings also mapping with that. So what we realized, using a proper designing, blended learning seems to be effective in imparting our knowledge and psychomotor skills in health professional. It is feasible in the developing country also. That is our experience for the last 2-3 years, what we experienced. Faculty training is the key. Training the faculty members in the blended learning approach. That's a challenge. That's the key. If we would like to implement blended learning, that we should focus on that. We should also, look into the further research, especially whether the blended learning can be effectively used for skill enhancement and the cost analysis. We didn't go for the cost analysis so far. We should also look into the cost analysis. So, that's what our experience implementing blended learning is. It's very feasible. We need to explore this method in health professional education also, so that our learners get the better learning experience and we are meeting the learning outcome. Thank you. I'll look for the questions.
Thank you so much, Narasimhan. We are close to the end of our time slot, so I think we probably have time for just one question. Maybe we can squeeze in 2. But I'll kick off with, what's the role of institutional support in implementing blended learning?
Yeah, as we discussed, that's a major, providing the learning environment, creating the online learning environment, and allowing us to deliver the course in a flexible mode, and training the faculty members, providing the access to the learning management system, and facilities to create the online synchronous and asynchronous learning materials. The institutional support is the fundamental, is the base. That's what we experienced. Since we had that support, we are able to implement it.
You mentioned the pandemic a couple of times. How did the pandemic influence the learning experience?
The pandemic was suddenly, we have to go for only online, so face-to-face was totally cut off, especially health sciences. We need to provide them the clinical exposure and the practical experience. That was a big challenge. We identified a learning gap there. Now the post-pandemic, we are using again the blended mode to improve their skills. Again, the digital tools become handy. We were really fortunate to have all these tools, so we were able to continue our the teaching during the pandemic also.
Okay, thank you so much. That was a really, really interesting presentation. I learned loads, and thanks for taking our questions. So thanks, Narasimhan.
Thank you very much.